intake assessment is how we can tell if a baby is feeding well at the breast. It is important to assess breastfeeding intake to ensure that adequate milk transfer is occurring during the feed, meaning that the baby is drinking enough milk from the breast. Good milk transfer is necessary to ensure the baby is getting enough nutrition for best growth and adequate fluid intake. For the hospitalized baby, it is especially important for the staff and families to be able to assess intake so that the healthcare team can feel confident in allowing babies who are recovering to feed at
fortified feeds, IV fluids, TPN, or medication. Medical or surgical conditions may also influence the baby's endurance and their ability to take in a full feed at
the baby is latched. It is important to recognize if the baby is swallowing milk or just suckling at the breast with no milk going to the baby. You can listen for swallows, especially in the beginning of the feed. Swallows sound like close. To see them, look for the open, pause, close pattern of the mouth when the baby is sucking. This can be most visible by watching the downward movement of the baby's lower jaw. The jaw opens wider, then there's a slight pause, then closes. It can be hard to notice this jaw movement at first, but with practice, it soon becomes easier to see the swallows. In the first few days after birth, when there is colostrum available in the breast, less frequent swallowing is normal, as it may take many sucks to get a swallow. Breast milk usually increases in volume 2 to 4 days after birth. At the beginning of the feed, as baby suckles to stimulate the milk flow, also known as letdown, you may see short, quick sucks. Letdown usually happens within 1 to 2 minutes of sucking, and you should then notice the sucks become longer and slower, with the swallow for every suck. As the feed progresses, you will see more sucks before a swallow, indicating that the breast is emptying. After the first few days following birth, the amount of swallowing can be a good sign of the mother's milk supply. If the baby is latched on well and actively sucking, but not getting many,
there are also signs of milk transfer a parent may feel during a feed, including